Yongling Gong has complete. Is she available? Our next speaker, you're welcome. Yongling has completed his PhD in gastroenterology from Linear Medical University of Shanghai in 1997. I'm sure she's representing him, currently working as a professor in the Department of Oncology. You are welcome.
Thank you. Okay, good morning everyone. So glad to stand here to give the research. I'm a graduate student, come from medical school of Southeast University, and this is my tutor, Professor Gong, in Nanjing First Hospital. Our topic is therapy responsible of decoction for removing blood stasis in advanced cerebral tumor of glioma. It's a retrospective observational clinical trial. We have successfully treated some kinds of cancers, such as breast cancer, liver cancer, and lung cancer, and give the relevant speech in the international conference. Okay, get to the point. As we know, Chinese herbals might be an additional choice with its better benefits and tolerability in the treatment of advanced cerebral tumor or glioma. Aiming at studying the ball rolling and contributing humble effect to promote traditional Chinese medicine, we performed the present study to assess the therapy response of Chinese herbal decoction of removing blood stasis compared to conventional therapy on clinical year patients of glioma in ICU. A total of 6 patients included 1 female and 5 males. We administered Chinese medicine, decoction of removing blood stasis mixed with a variety of effective herbal components to help the patient to recover from poor conditions. In the meanwhile, conventional treatment of surgical resection and radiotherapy was applied in cases compared. As we know, benign glioma, which is the most common type of intracranial tumor, originates from neuroglial cells, taking up about 45% of all intracranial tumors and 13% of primary central nervous system tumors, among which 76% is malignant. Clinically, it has characterized of 3 highs 1 low, which are high morbidity, high recurrence rate, high fatality, and low recovery rate. The prognosis is far from optimistic, especially that the average of survival time of malignant glioblastoma sufferers is less than a year, and the 5-year survival rate of the high malignant glioblastoma sufferers is under 5%. Abnormal activation and infiltration of tumor cells are leading cause of patient's death. Therefore, clearing about the pathogenesis and seeking effective treatments are quite significant. There is no doubt that surgical resection is the most basic treatment, but it is difficult to completely remove the lesions and easy to recur after surgery. The survival rate within 5 years after pure surgery is less than 25%. The survival time is usually no more than 2 years, and 50% patients must died with 6 months. And what about the radiotherapy? Evaluations to the correlative effect of radiotherapy are unsatisfactory. Moderate breast tumor is sensitive. Epidermal tumor is moderate sensitive. Other types are not sensitive to radiotherapy. The impact of radionecrosis to brain function also present clinically. And because of the drug resistance, toxins, and side effects with chemotherapy, and it is difficult to circumvent the blood barrier in blood to ensure the drug refusing within the tumor area. Even the subselective arterial cassette refusing chemotherapy is restricted in the application in clinical medicine due to its complexity and high cost. The latter in immunological therapy and macro-targeting treatment once become the hotspots, but their existing limitations often made them merely an amateur strategist and made it difficult for them to be widely applied clinically. So we have to turn to Chinese medicine because it is a medical system that is capable of treating a wide range of conditions together with acupuncture, massage, and food cures. They form the four distinct methods of treatment in Chinese traditional medicine, also known as TCM. Today, TCM plays a major part of healthcare in China and is provided in state hospitals alongside with Western medicine. It has become an indisputable fact that the treatment of malignant glioma in advanced stage is characterized by poor clinical efficacy and adverse outcome. Here, we are enumerating several cases which decoctions of removing blood stasis used to treat blood glioma and then making relevant discussion on them. 6 patients are chosen by the following criteria. Recover after surgical resection, progression after surgical resection and subsequent radiotherapy. Then advanced stage once diagnosis confirmed from onset. Firstly, we pathological detection combined with cranial MRI or CT confirmed the diagnosis of glioma in advanced stage. Then patients were divided into 2 groups. One group received the conventional therapy and the other received the TCM. It's the description and their dose. We tell the patient to have it twice at the exact time. It's case 1. It is a male of 53-year-old. It's a tumor with irregular boundaries, and it's glial cell carcinoma. And after the surgery, the patient received the radiotherapy, but after 8 months, it recurrence and many complications turn up, such as digestive hemorrhage and renal insufficiency. And the patient complained that he had a headache, vomit, fever, hyperfunction, the long limbs, and so on. In a word, is so painful, and we treat the patient with BSC, namely Best Supportive Care, and TCM, decoction of removing blood stasis by laser feeding. After treatment, the patient can recover of consciousness and his individual conventions improve. After 2 months of taking decoction orally instead of laser feeding, the patient can live independently and recover function of speaking and limb movements. Fecal occult blood test is negative, and the indicator of renal function turned normal. Consistently taking the treatment for 5 months, the lesions inside the skull shrink obviously, and the PFS prolonged. It's the straight graph. We can see that the lesions shrink. It is obvious. And case 2, it's a dynamic glioma. After the surgery, the patient take decoction. And finally, we can see that the stratigraph the lesions in the skull are shrink. And the third case, it's a malignant glioma with multiple lesions. Differently, before surgery, the patient takes decoction to prevent from progressing, obtain operative opportunity, and improve QL. And after the surgery, the patient also takes the decoction. And look at the stratigraph. The lesion here in the skull shrink after the treatment. At the same time, the therapy group received the conventional therapy, but unfortunately, the patient unable to decrease the material lesions, and the patient's condition worsened more. Finally, failed in having prolonged the PFS and TTP. Importantly, our patients in group CTM reported are still alive. We chose the other way and selected CTM participation in clinic anti-tumor treatment by decoction or powder to help prolong the PFS and TTP. And we follow up the patient every 3 to 6 months in internal history by the following aspects: physical examination, conventional laboratory test, CT and MRI. It's the illustration of the cases we mentioned above. All the cumulative effect evaluations is PR. Then, relative knowledge about CTM. CTM considers human body as a dynamic platform in which all organs are correlative and blind each other. Relationships among heart, liver, spleen, lung, and kidney is like interconnecting between mother and son. It's generally acknowledged that glioma is the pathological or bundle of lungart, which is associated with the internal organs yang-qi. Blind is the confluence of all the yang. Sufficiency or not can both affect the whole body, the cancer cell, and the resultant hemorrhage, infection, and obstruction in turn influence the qi and blood function of the internal organs, making vital energy even weak and causing a vicious cycle. And this is why it's hard to be cured and yet easy to relapse. Therefore, centralized swift is a fundamental solution treatment. Lysine, spleen, and kidney is the main law, along with promoting blood circulation to remove blood stasis and soft form flights of medicine. When facing with blind tumor, the digestive power of removing blood stasis decoction to tumor is relatively weak, so Panlangan is added. Correlating with radix astagonin, which greatly strengthens the abilities of promoting blood circulation for removing blood stasis and killing tumor gently. Okay, we go on. In order to maintain the warming effect of the prescription, something that can clear heat and cool the blood was removed from the original prescription. Palmalism has a special effect on epilepsy and depression in patients with blind tumor. The reason is that it plays a role in adjusting the functions of liver and gallbladder. Traditional Chinese doctors believe that The system of liver and gallbladder has an effect on adjusting patients' mood, stabilizing their emotion, and protecting patients from relapsing. And the CTM take into consideration patients' whole condition, including both body and mental condition, rather than confined to the cancer lesion itself. And each patient has its distinguished prescription, and to increase energy, heighten sense of well-being, reduce the side effects of radiation and chemotherapy, refresh marrow function, and improve appetite and sleep. The research of CTM anti-tumor effect has made great achievements in recent years. With the development of science, it has obtained a new understanding of etiology, pathology, and treatment of the tumor for human beings, who will pay a great deal of attention to the mechanism of the anti-tumor effect in traditional Chinese medicine. So it is clear that CTM has a good prospect in the treatment of benign glioma, and it is of great value to be applied, and has the effect of anti-glioma, and has the advantages of multiple approaches, multiple targets, more efficacy, and less side effects. An additional choice with better benefits and tolerability in the treatment of glioma. A potential alternative of chemoradiotherapy tailored to individual patients. At the last, it's our team members and the work we do. Okay, that's all. Thank you.